Welcome to the General Scribe Orientation demonstration from MedMacros. MedMacros is a product that assists scribes with their physician documentation in the emergency department, hospital, and specialty clinics. This video will focus on the emergency department version of our product. MedMacros is web-based, and after your logon in any browser, you'll be directed to the note generator or main page seen here. Our materials are focused on medical decision-making, augmentation, and assistance so that you are better able to help your physician document these portions of the note. The first thing that must be done is generate the materials in the note generator or main page on medmacros.com. After logging in, you'll be referred to this page. The materials are age-specific, so in this case, let's say that this is an adult with a chief complaint of chest pain. Entering the chief complaint generates a differential diagnosis in the box on the right. In the Scribe version, you must enter the Scribe prefix to generate the Scribe-specific version of the medical decision-making template. In this case, let's say that this is a chest pain patient that you will admit. Clicking on this generates the medical decision-making on the right. These materials are then simply copied to the clipboard, and the individual can enter the electronic medical record. Upon entering the electronic medical record, you will proceed to the impression and plan, or the medical decision-making portion of the note that you had previously completed. To enter the materials, simply right-click and paste the preliminary materials into the note. You can see that there may be some formatting issues based on which EMR you use, as only limited materials/formats are able to be imported into the electronic medical record. Feel free to alter the formatting, for example, eliminating the paragraphs, etc., as you see fit. The main items to note in the Scribe version of MedMacros is the multiple areas that are 3-starred. These require your attention on each and every patient. Next to every 3-starred area, there are specific instructions in parentheses. You must address these on each patient. For example, in this case, the instructions are specific symptoms and character, i.e. chest pain, shortness of breath, etc. More detail is generally ideal, and for example, chest tightness, intermittent, or stuttering, in addition to shortness of breath, will be one thing that you could enter here. For simplicity's sake, we will simply enter chest pain. You can then erase the 3 stars, or if you're not certain of what you've entered, you can leave the 3 stars for your own reference or for the physician's reference when they do a final review of the note. It is important that you go through the note and enter the appropriate materials in parentheses at each and every 3-starred area. It is also vital that you become intimately aware and familiar with all the materials in the note, and that you change them appropriately if there's anything that doesn't apply in the case. It is absolutely vital that you do not leave anything in the medical decision-making that did not occur in the emergency department. Generally speaking, the materials are quite common for the respective complaint, and we anticipate that the vast majority of the time, the materials in the medical decision-making note will apply to the specific case based on the patient's age, chief complaint, disposition, and discharge diagnosis. Important things to remember in this general overview of the Scribe Augmentation version of MedMacros is number 1, be certain to select the appropriate age. In addition, with the chief complaint, there are some sex-specific materials when there is a difference, such as abdominal pain in a male or female. It is also important that you are very particular and precise in your discharge diagnosis and disposition to generate the correct medical decision-making materials. And again, once you have entered the electronic medical record and placed the materials into the medical decision-making portion of the note, it is vital that you account for every 3-starred area and instructions in parentheses. It is vital that you add as much information and are as precise as possible and generate a unique chart for each patient that is highly specific to the physician's preferences and the patient's unique emergency department course. When in doubt, it is important to leave the 3 start areas for review by your physician, and you should also be liberal with your questions to the emergency department physician with regards to the note. Thank you for your time, and feel free to visit us at www.medmacros.com or visit MedMacros LLC YouTube channel for additional complaint and system-specific instructional videos for Scribe augmentation in the emergency department. Thank you.